Dr. Jenny Crosby here today. I'm going to talk about chronic pain that we can't seem to get rid of. One of my favorite patient stories was a gentleman. He worked as a security guard in a shopping mall. And I would see him, we got rid of his neck and shoulder pain, but I would see him about every 2 weeks because about every 2 weeks, the pain would start to come back. So we had him in this holding pattern, right? Every 2 weeks he'd come in, get his adjustment, he'd be good for 2 weeks. And I asked him, are you using a computer mouse a lot? Because that would explain why this keeps recurring every 2 weeks. And he would say, no, I'm hardly ever on a computer. Okay, are you on the phone a lot? Because again, if you're on the phone a lot, that could cause the shoulder pain and to come back, right? The neck and the shoulder pain, especially if you're doing this with your phone and not using a headset. No, I'm not on the phone a lot. Okay. So one day I was at the mall and I'm watching the security guards, and they have their belts on and they have a baton on their belt. And I'm watching them all walk, moving their arm like this to clear the baton. And that's it. Sometimes there are things we do in our job or in our daily life that we do repeatedly as a repetitive motion. And for those patients, they are always going to end up with recurrent neck or shoulder pain, whether it's mousing, whether it's phones like this, or whether it's a baton that you're wearing and trying to clear. And part of getting you past that holding pattern is changing those habits. And if we can't change those habits, we can keep you in a holding pattern so that you can be the healthiest version of you for as long as possible, because that's what it's all about. Quality of life and working with life and all the things it throws at us.